Diana Allied, and today we're going to talk about arthritis. Now, you've heard the term arthritis before, but what do you know about it? Something old people get? Something that makes their fingers look funny? Let's talk about it a little more. There's different types of arthritis. There's osteoarthritis, rheumatoid arthritis, and gouty arthritis. There's another, but it's not arthritis, but because of the way it works and acts, I put it in here as well, and that's osteoporosis. Back to arthritis. All right, osteoarthritis. Osteoarthritis is kind of like wear and tear. It can also be called degenerative joint disease, DJD. Wear and tear, what does that mean? Your joints, when the bones come together in a joint, have fluid and they have cartilage. And this cartilage makes it so, like your knee, it glides on there. It's smooth. It cushions. When you have arthritis, this type of arthritis, osteoarthritis, that cartilage, that fluid-filled sac to cushion and make everything nice in there, is gone. It's been worn off, either by repetitive injury or just age itself. You know, gravity pushing down does things. So, osteoarthritis, wear and tear. Folks that have played football or soccer tend to get a lot of this in their knee. But it can happen certainly other places. So when the cartilage gets destroyed, you end up with bone sitting on bone. Now think about that. The creaks and cracks and pain that can come with that. Your number one risk factor is age, and then injuries, repetitive use. I already spoke about football players or people who play sports. Also, people in the nursing field, you know, we're on our feet a lot and on concrete. That can be another risk factor for this as well. Number one place to have it is knees, hips, and fingers. And this aches, this hurts, especially when you first stand up or first when you're just sitting down. It's, oh, you see people get up and they're like, and they hold on and take a few steps, and little by little they're a little bit better. That's that osteoarthritis, that bone sitting right on the bone. And that's what they deal with that. Okay? The second type is rheumatoid. Rheumatoid arthritis is very different. It is an autoimmune disease. What? Autoimmune, I'm sure you've heard of it, but do you know what it means? This is when your own immune system is all hot and bothered. It's inflamed, it's mad, and it thinks something in your own body is the enemy, and it attacks it, tries to destroy it as if it were the enemy. Now, it causes inflammation and total joint destruction. Most common places is hands and fingers, but it can be everywhere because this is systemic, meaning all over your whole body. It can infect different things besides your joints. At high risk, people with immune system issues, and this affects more women than men. Okay? With this, you get hot, red, inflamed joints, and this totally destroys the joint. Okay, the last one, gouty arthritis. This is when uric acid crystals. Now, this is caused from eating foods that have high purine, and it has to do with your liver and other things. But what happens is these uric acid causes crystals that under a microscope look like shards of sharp glass. And these tend to settle in your great toe. That's your big toe, and especially, you know, that joint just at the base of your big toe that kind of sticks out a little bit. That's called your PIP joint, and it can get very red and hot and swollen. I mean, it's a very painful, ugly looking thing. And you can also tend to get it on your bigger joints in your fingers. Younger people tend to get this, older people as well, but while some of these don't start until your 60s, this one can happen even in your 30s and continue on throughout your life. Tends to happen more in men, but certainly women get it as well. All of these are part of the arthritis family. And so when they say they have arthritis, just be aware, not all arthritises are the same, but they do have some things in common: pain and joint issues. Okay? All right, let's go to our last point I want to mention. It is not an arthritis, but it does have to do with musculoskeletal. This is osteoporosis. Osteo means bone. Porous. If something's porous, it's what? It's got little holes in it, right? So this is when your bones are getting very porous, have little tiny holes through them, because you have lost some of the minerals in your bones. And your bones now look almost like a big pretzel. You know those hard pretzels? You can break them. These folks can break their bones very easily. It doesn't take much. In fact, sometimes they get something called a pathological fracture. When they break a bone just by standing, they can stand up and start walking, their hip breaks, then they fall. Not they fall and break their hip. They break their hip and then fall. It's called a pathological fracture. And that happens to folks who have very, severe osteoporosis. Now, these result in very weak bones and can cause fractures, and the most common is in the hip and the vertebrae. The spine. So, the hip, I think everybody's heard about folks that fall and break their hip. It's very common in nursing homes, and it's very serious because there have been studies done that show after a hip fracture that it seriously reduces the life expectancy of that resident. Not only that, the quality of life. Not only that, but they're afraid. They're afraid to walk again because they're afraid to fall and break their other hip. So that's a real issue. Fractures in your vertebrae, that's in your spine. So we have little vertebrae in our back that are shaped kind of like this, and they stack on top of each other. And then your spinal cord kind of runs down through there. This is to protect your spinal cord. But what happens in age is these right here, this is a cushion called a disc. It's a fluid, a nice cushy cushion. And these are the bones. Well, when you got osteoporosis, these get holes all over in them, little tiny holes. And just baby's birthday and gravity, standing, all of this pushes down, and this cushion, these discs, lose their cushiness and collapse onto each other. Now, these bones, if they're really fragile and have holes in them, they develop little cracks, little fractures and cracks in them. I even saw a lady who was one of our dear residents, and she had a corner that came off. You could actually move it under her skin. Freakiest thing. Extremely painful, extremely painful. Not a whole lot they can do at this point with them. There's surgeries, but some of our folks cannot withstand big surgeries. Some of our folks, it's up to us to keep them comfortable and do the best thing we can to support comfort And that's the thing I want to talk to you about, is what can you do? What can you do to help with this? Quick story, I had a lady who every time, this is when I was a very young CNA, every time I went in to transfer her, get her up, or especially get her from the wheelchair to her easy chair, she would just have this terrified look on her face, and the minute I started transferring her, she would grab onto me and just shake and start yelling, and oh, ouch, ouch. And I would say her name and say, I'm just transferring you. I am being as careful as I can. Please, let's work together. I just need to transfer you. And one day she said to me, just being alive hurts. And she said, I wish you could understand how just moving is so painful. I didn't know what to think. I was a young, very healthy, rather athletic young woman, and I couldn't imagine how just slightly moving or sitting down could be so painful and frightening. I started looking into it, and I started to understand a little bit more. Once I saw pictures of this, right? Once I saw pictures of the bone on bone, which I have in your units here, and understand how that pain can be, how those bones rubbing up against each other, cracking, how that can hurt. So I decided to go to work and try and figure out what I could do. So talked to the nurse, and unfortunately she wasn't real helpful. And you'll have this sometimes, guys. Please understand that they're busy too, and some of them just don't have that. That doesn't mean that you can just throw up your hands and say, oh well, we can do things. So what can you do? I went to my nurse, and she said, she's on the highest dose of pain medicine we can do. I don't know what you want me to do. So I started thinking about it, and I went back up and I said, well, what if we can have like some icy hot or something at her bedside? And the med aide told me, I don't know if they'll let you, because they don't usually let drugs be at the bedside, because if a confused person comes in. And I asked the nurse about it, and she goes, well, you can't administer that because it's considered a medication. So then I asked, well, what if I put like a little lockbox with it, and I can go in and hand her like a roll-on icy hot, and she can rub it on her knees. Then I go take care of another resident and come back in and let that take effect, and then I can transfer her. Okay, that'll work. So I started doing that, and I don't know how much pain relieving it really did. I'm sure it did some for her knees, but I couldn't put it on her spine because she couldn't reach there, and I wasn't allowed to put it on. But at least it helped the knees, and she knew I had her, that I had her best intentions in mind. And when I went into that room, I focused on her, and our transfers were better. They weren't perfect, but they were better. She wasn't so tense and frightened. She didn't have that fear in her eyes. She knew I had her, and we were able to proceed. These are things you can do, things that are not difficult that you can do. There's also positioning with pillows. Just getting 2 or 3 extra pillows and propping that elbow or those knees or that back that hurts to a point where they'll say, oh, that feels better. That's immense. That is enormous. Those things are very important. Doing your part to work, to try to find ways to help. That's what it's about.